Починаємо.
We start.
Щось я не бачу взагалі. Що там? So we are online or not?
Please start.
Yes. So, okay. Dear friends, colleagues, we are glad to welcome you to our disputable club treatment of hyperpigmentation and melasma. We are glad to welcome everybody starting from Lisbon and to Jakarta, and I hope in all the countries the time is suitable for you. And today we together with Dr. Inneke and Hidajat will talk about those two problems, because we have to understand very clear is that hyperpigmentation and melasma are different diseases, different problems, and we need different approaches for the treatment. We have to understand what is possible to do, what is not, and to understand, and we will clarify what are the ways of the effective treatment. We will discuss with Inneke all this, and first of all, let us remember what kind of melasma can be. So it's epidermal, dermal, and mixed. And we were just talking with Inneke that, well, hyperpigmentation and epidermal melasma, it's not so hard to treat them. If we are talking about dermal melasma, it's much more worse thing, and to treat it, we need much more efforts. And well, Inneke, what is your opinion?
Yeah, thank you so much, Professor Alex, for introducing about our topic today. So melasma itself, I think it is a very complex hyperpigmentation disorder, either it is epidermal or dermal. And agree with you that epidermal melasma is easier to treat more than dermal melasma, since we just have to get rid of the epidermal layer, which is easier. However, since if the pigmentation, it goes deeper to the dermal area, it is the place where it is hard to treat by topical and sometimes even laser. It is quite hard to treat the dermal melasma, and it is quite challenging, especially in a tropical country like Indonesia. And I think for the melasma itself, the target treatments, it consists of multimodalities to target every pathogenesis of the melasma itself.
And well, in my opinion, hyperpigmentation and melasma, they're even much more bigger problems in Asia, in Asian countries, especially in Southern Asia. This is really big problem, and people. Well, there are two things. One thing, it's the regional problem. The other thing is that the local culture of the majority of the Asian countries, in my opinion, it looks like people like to have white skin, and to have the skin with the signs of melasma, it's awful. It's well, they don't know what to do, and for them it's twice problem. One, it's the problem with health. The other one is the social problem. Yes.
Yeah, and actually, I will add another problem, Professor Alex. It's about the after treatment problem, because treating more pigmented skin color, especially with energy-based devices or anything that could cause irritation to the skin, actually will lead to another, what we call post-inflammatory hyperpigmentation. So sometimes when we are addressing to treat the hyperpigmentation, even though it is only epidermal area, but if we treat them too aggressive or sometimes, we have online shop here, and they could, like, they could look for like what medications they can put it on by self home remedies and everything. Sometimes it is too irritative for them, and it leads to another problem, which is post-inflammatory hyperpigmentation. So yeah, it's going to be like three problems.
Yeah. It's well, and what is the most strange, because maybe, well, if we will talk about times that were, for example, 20, 30 years ago, when we have no EBDs, we have just two problems. It was melasma-like disease and hyperpigmentation after the sunburn. And now we
Yeah.
have the third one, is the hyperpigmentation or melasma can occur after our procedures. And even more, yesterday we were talking, and in dermatology we are using Fitzpatrick's types, yes.
Yeah.
But if we are talking about the cosmetic dermatology, about the aesthetic medicine, if it's even better to use, there was such surgeon, Nabil Nabil Fanoz, and he described the classification of the skin types that was based on the possibility of the occurring of the hyperpigmentation after the EBD injectables and EBD procedures, means after the trauma. And what is the most strange? Well, it's not the strange, but for the majority of people, it's strange that more dark is skin, more responsible for the hyperpigmentation it is. Means that, for example, for the people in Sweden, it's not a big problem. But for the people in Middle East or in Southern Asia, it's really a big problem. One hand, we need to do something, I mean, the procedures. Other hand, we never knows, or even using that Nabil Fano's classification, we understand that the risks of the hyperpigmentation are growing, and even more. The biggest risks are in Africa, where there is the sixth
Yeah.
type. It's strange, yes, that people with totally black skin have the biggest risk of appearing of the hyperpigmentation, and even more, it looks awful because it looks like dark blue spots.
Yeah, agree. And yeah, I think it is also because I think after some trauma, what I know is that the in darker skin type, the melanosome transfer, I think it is like it's different from the whiter skin type. Yeah, it's kind of ironic if like someone came to the clinic, they're trying to look to get rid of their hyperpigmentation, and then they got hyperpigmented lesions after the treatments. So I think having this is a very good opportunity for us to discuss like the approaches by Professor Alex, and the approaches probably in a more colored skin type.
Yes, sure.
Yeah.
Well, let us look on our next slide.
Yeah.
What is the main treatment option for
Okay.
hyperpigmentation and melasma? Well, it's my opinion well, about polyphenol acids. I don't know, maybe not all of you knows what is this. It's something like the competitor of hydroquinone, because hydroquinone is on the second place, but we know that hydroquinone, after the long usage, or using high concentration, it can cause hyperpigmentation or hypopigmentation. So it's really dangerous treatment, and in some countries hydroquinone is forbidden. Well, so polyphenol acids, they are in some cosmetics. Hydroquinone, retinoids, chemical peels, but I'm not agreed. Honestly, I'm not agreed with chemical peels. I mean, to use them for the hyperpigmentation. I never seen really good results from chemical peels. Laser peel, yes. IPL therapy, it gives the result, but the result is short. It gives the result for 2-3 months maximum. After that, it disappeared. Well, lightening creams, it must be, I mean, home care, and modern chemical devices like succinic acid, like polynucleotides, like others, but they also have to be used in the combination with others. What is your opinion, Inneke?
Okay, so professor, here in Indonesia, we still use hydroquinone as our first line therapy, but it has to be under doctor supervision or dermatology supervision. I think for the hydroquinone itself in Indonesian skin type, Southeast Asian skin type, what is concerning is the development of ochronosis, which yeah, before the hydroquinone, it can be people can get it like not under doctor's prescription, like they can get it freely, and it causes them ochronosis. That is another big problem using the hydroquinone. However, we are still using it as our first line treatment for treating hyperpigmentation and also melasma. But we use it like we started with a very the lowest concentration possible. And however, the skin irritation, sometimes patients cannot bear with the irritation caused by the hydroquinone. And other polyphenol acids that we are also using here is the kojic acid, and then the arbutin, which is like milder. The irritation is milder. And yes, retinol. Retinol, we also use it in treating our hyperpigmentation and melasma patients. And I think for the retinoid, the other important thing is not only the brightening effect of the skin, it also gives a healthier dermal components of the skin, and it helps to eliminate also the melanin over the epidermal area. And I always include retinoids in the daily basic. So for hyperpigmentation and melasma, the first line treatment for me is still topical treatments for the patient, because it's not only like getting rid of the hyperpigmentation, patient also can get a very good skin quality that also helps with the skin complexion overall, not only about the skin tone. For the chemical peel itself, me too, I seldom use the chemical peel for our patients. Laser peel, I use the laser peel a lot. It gives us quite a significant effect, an instant effect on the patients. Patients feel good about it. However, we still need like, a repetition for the laser peel. IPL therapy, in my opinion, it's quite it's quite the window between the safe and dangerous is a little bit narrow because of the broadband, and in our skin type, it's not too good for the IPL treatment to get the results. And not little of the patients get burned from IPL treatments in general. And yeah, for lightening creams, sometimes we also use a vitamin C for the regimen of the lightening creams. And this is the other thing that is quite interesting for me, is the one of the you mentioned, the modern chemical devices is the succinate, which is include one of the skin hyaluronic acid, which helps with the anti-aging for the patient, and also it helps to give a better skin quality. However, it also helps with the pigmentation. And for some patients who come who comes like in a later age, like 40s, they love the result if you are treating them with the hyaluronic acid and succinate, like a skin booster, because they have getting the hyperpigmentation better and good skin quality.
Look, I will try to explain. When I was talking about polyphenol acid,
Yeah.
It's not, it's
Yeah.
something new. And what is the problem with hydroquinone? Because I don't know how you, but in my practice, minimum 30% of patients have complications with hydroquinone, I mean irritations.
Yeah.
Minimum 20% have have returning back of hyperpigmentation after finishing the treatments of hydroquinone. And hydroquinone also is not safe from the different points of view. And polyphenol acids, I have found some trials that shows that polyphenol acids, they give the same result from the point of view of quality, but they are much more safe. Regarding retinoids, well, I don't like to use them in my clinical practice for, I mean retinoids for whitenings, because you know that cosmetic procedures, when you are putting applying retinoids and blah blah blah, to use them in creams from pharmacy, it's also not the best idea. Retinoids, pharmaceutical retinoids, they have other topics where we can use them, and they have nothing to compete. But on the other hand, it's really great to use retinol in cosmetics, I mean in daily home care. For example, here in Europe, I don't know, do you have, but here in Europe, we have such line as Institutum, and some positions, they have retinoids, and they gives really great result, and that result is not just the cure of the hyperpigmentation, it's also the anti-aging, it's also the, well, every lady want to be beautiful, and that line Institutum, it gives really great result. And among other problems, also treatment of the well, not treatment, curing at home of the hyperpigmentation. Regarding chemical peels, I have told laser peel, yes, if we have melasma, especially if we have deep melasma, we can't achieve good result without lasers, but we will discuss later. Regarding IPL, you know, I'm totally agreed with you. As for me, IPL is a good choice for the vessels. Why? Because we have no chance to treat cuperosis at all. There is no chance. We have to do something. And it's much more easier to treat with IPL, I mean recovery period, than with laser. And the period of duration is the same. So, but not for pigmentation. Lightening cream, well, I have mentioned once, we have such line Institutum, it's really great, and we can put them also in lightening cream. And regarding modern chemical device, I mean medical devices, if you are talking about succinic acid or combination with HA, for example, Xaluriderm, yes. As for me, it have no direct anti-pigmentation effect. It can be, well, because the model of active influence is totally different. But we have to understand that in pigmentation, the one of the major active moment is the inflammation. Inflammation in the skin, inflammation in melanocytes. And until that inflammation will goes, the hyperpigmentation will grows, the melasma will occur, and we need to use something what have anti-inflammatory effect, what can teach the skin how to struggle with inflammation. And in this situation, succinic acid is something, well, it's something that was in the skin, in our body, from the moment when mankind appeared, because succinic acid, it's a part of the major biochemical reactions in the tissues. But if we are injecting devices with succinic acid and hyaluronic acid, such as Xaluriderm, we are treating and we are learning skin how to fight with inflammation. No inflammation, I mean low-grade inflammation. Well, high-grade also. If you will put iron on your hand, you will have, in 2 weeks, you will have hyperpigmentation. And if we are teaching skin how to fight with low-grade inflammation, no inflammation, no pigmentation. Everything is very clear. So it's very important step, not just to fight directly what we are doing, for example, with peels, with IPL, with hydroquinone. We are fighting directly with the hyperpigmentation, I mean with melanocytes and with their quantity. Especially when we are talking about lasers, we are fighting directly with the big quantity of melanocytes. It gives very short result, but if we will combine with, for example, succinic acid with HA, we are teaching skin, we are treating, we can remove melanocytes from one part of the skin where we are making laser treatment. We can remove them, we can destroy them, but if we will not use something that will teach skin not to produce too much melanocyte, the effect, the final effect will be zero. So,
Yeah.
our first
Yes.
disputable question is about laser treatment. Is it myth or reality? So what is your opinion?
Okay, so for laser treatment pigmentation, it can be a reality for especially for some pigmentation. I would say for epidermal pigmentation, yes, it is most efficient and effective.
Well,
Oh, yeah.
look, my
What is your
opinion is
opinion, doctor?
here that for sure, if we have melasma, especially melasma, if we have hyperpigmentation, just hyperpigmentation, superficial, we can, well, we can use the laser to have the more quick result, but we can do it without lasers and everything's okay. If we have melasma, for sure, we have to use at least Q switch. It's much more better to use picosecond Q switch, and the major players that we have Picostar and Picosure, and Picostar is much better because it have less than 300 picoseconds, and Picosure it's more than 700 picoseconds, means it's nanosecond. And if we are talking about nano, we have the option Nanostar. Where we have two also, it's mixed, it's not Q switch, it's mixed technology. And even we can use yellow laser to treat hyperpigmentation. But once more, using lasers, it's obligatory, especially if we are talking about deep pigmentations, deep melasma, but just with lasers, no chances to treat for a long period of time. It will be, we remove black spot, it appear. We remove, it appear. And if we will combine this with succinic acid, we will remove and we will be on safe side for a long period of time. And one more thing, for example, if we are talking about deep melasma, hopefully not too much patience with it. Without lasers, no chances. But if we are talking about superficial, there is the question cost of goods. Not in every clinic there is laser, even Q switch. Not every doctor can buy it. And even more, it's because I'm working with lasers, and I prefer to do the wall face resurfacing, because when I'm doing wall face resurfacing, it costs from 700 to 1,000 euros per procedure. If we are talking about hyperpigmentation, patient will never pay more than 50 euros. And the cost of laser is really high. So if we are talking about the major hyperpigmentations, I mean superficial, if we have laser, we can use, but if you have we have a lot of option, and combining with succinic acid with Celeroderm, we will achieve great result even without lasers. Do you have same opinion or not?
Yeah, so for melasma, for with laser, I think for me, in my opinion, I think that is not going to be my first approach for melasma patients with laser. Dermal, yes, they do need, but what I really need them to understand is the whole thing about the melasma, like the sunscreen, like the sun exposure, and then also the topical treatments, like everything they should understand before I proceed to the laser treatments. Because like you mentioned earlier, that laser treatments, it cost quite a lot, and I'm sure that patient also expecting something for something they have like paid. So I think I need them to really understand about the whole thing about melasma. And yes, we can put it in the regimen of treating melasma, but like we should really approach it from every sides of melasma development.
Well, by the way, colleagues,
Yes.
if you have any questions, you can write in the chat, and we will try to answer together with Inneke. So don't be afraid to ask the questions. If you are not agreed with something, also don't be afraid, and we will try to explain you that we are right. Well, pigmentation can be removed once and forever or not. Okay, please. You can
Again,
say it first.
again, depends on the pigmentation itself. Yeah, for epidermal, yes, it can be removed once and for all, except the post-inflammatory hyperpigmentation develops. Then we're gonna face another problem. But for like pori nevus or nevus of Ota, yes, we can remove it, but it needs like several repetitions. But for melasma, for me, it is like can I say like bluntly impossible to remove melasma with once and for all.
Well, I will tell that the majority of pigmentations can't be removed for all. Some of them, yes. But the majority of pigmentation of those that can't be removed, if we are using the right way, I mean sunscreen, I mean cosmetic like Institutum, I mean regular treatment with Xoriderm, we can achieve the result when the patient will not see the pigmentation at all. And some of them, the results are really very poor. I mean about deep melasma. But in that situation, we can use Picostar, and after destroying melanocytes with Picostar, we can use Cellrederm, and we also can have the result. So it depends. If you are talking, can it be removed that it will start to be invisible? Yes, it can. If can we treat once and for all? It's impossible. But we can prescribe to the patient the series of procedures, the way of taking care about the skin that even deep melasma will be invisible. And one of the main role in this place, well, that was on the last but not least place, modern chemical devices. For example, succinic acid and hyaluronic acid, the combination. So
Yeah.
melasma is not treatable, yes or not?
It is treatable, but it's not curable.
Yes. So no, melasma is treatable. It's a long process. We never see the finish, the end of this process, but we can see the result. So this is the process with result, but without end. Professional cosmetic can completely solve the problem of pigmentation. What's your opinion, Inneke? We are talking about professional.
So professional cosmetics is something that we give a prescription thing, is it? Is that
I mean
what you
the
mean?
procedures in the clinic. I mean the I'm not talking about I'm not talking about remedies. We are not talking about hydroquinone.
Okay.
We are talking about the procedures in the clinic, in medical spa.
Yeah. I hope it can completely solve, but sadly, I have to bluntly say it cannot completely solve all the problem of pigmentation. For me, honestly, I think it needs a good cooperation with the patient also and the patient's lifestyle. For me, especially in a tropical country, like sunlight from January to December.
Well, you know, I will answer this question from my history, from my story, from my life story. When I opened my medical practice, I was dermatologist and also there were some cosmetic procedures. And I was, well, not me, some people were working with me. We were doing some cosmetic procedures like cleaning of the skin, mechanical cleaning, you know this. And I was explaining to patients that it's okay. After that, I learned how to make the injections. And the time of injection is 10-15 minutes. For example, if we are talking about Botox, yes? 10 to 15 minutes, it's finished. And it costs a couple of hundreds of euros. And that cleaning procedure costs 50 euros and it lasts at least 1 hour, 1.5 hours. So I understand that it's bullshit and the main are injections. In a couple of years in my clinic, some EBDs appeared. For example, I have now lasers, RF, bipolar, monopolar, like Agnes. You should know it's from Korea. It's very close to you. And others. Until I have no EBDs, I was telling that what for EBDs, it's for nothing, it's need to invest a lot of money, and I'm earning money with my hands and my head because I'm doing injections. Now I'm looking for people who will work in my clinic to do the injections because, if you are injecting Botox, yes, or fillers, a lot of complications can be. And for example, with fillers, okay, I'm talking with patients, I'm explaining, I'm listening, I'm spending 1 hour to make the lips, and it will cost 250-300 euros, yes? And I'm spending 1 hour. During that 1 hour, I can do 2 resurfacing. Each of them will cost 700 to 1,000. So for 2, I will earn 1,500. So you understand that the BDs are better than injections.
Okay,
What I was talking about.
that is the most, Professor, that is the most important takeaway for me.
That is why I have tell about this, that professional cosmetics works really great, but just in those spas that have in those clinics that have no injection and no EBDs. From the moment that clinic have employees that can make the injection, for example, Derm, they start to understand that the level and the result from professional cosmetic is not so good as they were thinking. So it can solve the problem just if you have no other options. If you have any other options, you understand that the professional cosmetic is the level number 1, and injectables, for example, Derm, it's level number 7 or 10, yes? And that's why, but what our colleagues should understand, we were talking about the professional procedures. And if we are talking about the home care, and you have any problems, you can use Institutum, you can apply, well, you should use Institutum Cosmetic, you should apply it every day. Not me, because I'm man, but women should use it, should apply, and everything will be great. Because anyway, every woman is using some kind of cosmetic. I'm not talking about decorative cosmetic, about lipstick, I'm talking about creams, serums, and also cells. And it should be done, and we can't compare professional line and home line. And in that situation, well, the professional cosmetic can't complete, the home care should be, it must be, especially in the people who have the problems with hyperpigmentation. Oh, we have some questions.
Okay.
What is the best therapy combination for melasma? It seems to me that we have answered. If we are talking about the superficial melasma, we can do just injections. We can use the cosmetic institutum for home care and everything. Okay. If we are talking about deep melasma, we should find Q switch or better picosecond laser,
Yeah.
and also combine with Xelriderm and cosmetic, and that's all. Next, which have the best result for melasma treatment? The question I will translate. Which laser gives the better result for the melasma treatment, Pico laser or Q switch neodymium YAG? First of all, Pico lasers is also neodymium YAG Q switch. The difference between the traditional Q switch and picosecond laser, it's the difference between the time of duration, and usually the time of duration is the difference of power. Due to this, if we are talking about traditional laser, it's the thermal effect. If we are talking about picosecond laser, it's especially about picostar, it's electromechanical effect. But anyway, it doesn't matter which one. It depends what kind of laser do you have. Picosecond is more effective, a little bit more effective, but it also is a little bit more expensive than traditional Q switch. What do you think about fractional CO2 laser for treatment of pigmentation? I think that people who are treating, it's my opinion, maybe Inneke have the other, but I think that people who are treating pigmentation with CO2 laser, they are great people because they give us a lot of work. Because to use CO2 for treating of pigmentation, well, this is the direct way to have the pigmentation.
Choose, yeah. But I think, Professor, but I think, this is what I encounter in some patients. There are some practitioners who actually use the ablative CO2 laser to treat the hyperpigmentation, and I think this is the
Ablative?
Wow. Fractional ablative. So I think this is the right place for us to probably to deliver this, that using a ablative fractional CO2. I think it's not the proper way to eliminate the hyperpigmentation.
Look, I have no CO2 because when I was choosing, my choice was erbium, and I'm using erbium on the cold regimen sometimes for the treating of the very superficial hyperpigmentations. The cold regimen and superficial hyper. If I'm just thinking about the deep process, I will never use not CO2, even erbium YAG. I will never use for treating this because I understand that this is the direct way to cause the pigmentations. But
agree.
well, next questions. What ingredients in professional and home skincare products are responsible for effective result? What to look for when dealing with pigmentation? It's a question from Sana Evans. Dear Sana, thank you very much. We have the great topic for the next webinar about the ingredients in cosmetic and how they work. Sorry, it's impossible to answer right now in very short answer, because this is the topic that we can talk at least 1 hour about this. Well, Kemal Ibrahimova, how to understand is it epidermal hyperpigmentation or not? At least to look into dermatoscope, at least. And the last question, what major variation in approach to treat different skin type, especially type 4? If we are talking about type 4, well, first of all, I have to tell that there is the other classification, Nabil Famos. I don't remember. It seems to me that that guy was the Algerian origin, but he lives in France or something like that. Nabil Famos, plastic surgeon, and he have made the classification that that was really great for the analyzing the risk of the hyperpigmentation. If we are talking about type 4 skin by Fitzpatrick, in my opinion, well, this skin is risky. It's risky if we are talking about the possibility of hyperpigmentation, and for sure, if we are talking about type 4, well, we can use Q-switch if you're talking about lasers, yes? You have to understand that why, for example, I'm talking with our audience now, not with you, Inneke, I know that you understand. Guys, you have to understand one thing, that different lasers have different levels on influence. That is why the less selective laser is CO2. That is why after CO2, the quantity of the possible hyperpigmentation is the highest. For example, if we are talking about erbium, it works by heating the water in the skin. And if you are doing everything in the right way, that is why we have hot regimens, we have cold regimens. If you are doing everything well, the risks of appearing of hyperpigmentation are very low. If we are talking, for example, about lasers that have to struggle with pigmentation, with pigment, yes? The level where they are working is the level where melanocytes are. And if you are using the right parameters, you will never have after such lasers, hyperpigmentation. If you are using wrong parameters, okay, everything can occur. But anyway, if we are talking about the type 4, well, I think at the beginning I will try to solve the problem without lasers. I will try to solve. I will try to solve it with cosmetic. I will try to solve it with polyphenol acid or hydroquinone. I will try to prescribe to patient institutum for a long period of time. I will try to inject Xella. I will try to do everything not to use EBD. If I will see that there is no result, I will start. If I will have the patient type 2, I will do it. I will do the laser procedure. After that, the series of cell derm injection, and goodbye. If I will have the patient with type 5 or 6, I will tell him, okay, you know, I'm looking on you, and from this distance of 3 meters, you are nice and beautiful, and I don't know how to treat you, because I will understand that with type 6 and hyperpigmentation, it's probably impossible to treat. What's your opinion?
Okay, yeah. So for darker skin type, energy-based devices, my opinion is it's not going to be the first resort. It's probably going to be our last resort. And the most important thing for using a laser and is seeing the endpoint. Like try a test spot and then see the endpoint, because sometimes the parameter that that is already established, especially for darker skin type with pigment lasers such as 1054, 532, or 650. The endpoint is, we can reach the endpoint even with a lower energy because of the density of the melanin of the chromophores. So what I am going to emphasize here is the importance to see the endpoints when we are treating the patients, especially in darker skin type.
So great. One more. Someone suggest one of my clients CO2 for pigmentation. Ikra Imam. Ikra, it was your enemy. That person who suggests to your patient CO2 to treat the pigmentation. Is a genetic factor contributing development of hyperpigmentation? What can we recommend for such patient to prevent the risk? Yes, there is, for sure, there is a genetic factor. And what we can, for such patient to prevent, well, very shortly, we can recommend them to use Institutum cosmetic and everything will be okay. And to use sunscreen blocks, for sure.
Yeah.
Sunscreen blocks, at least 50. And not 15, even not 30, at least 50, 50 plus. And one more I put here in the slide was main treatment options. And you see here are the main treatment options, and you should do all this. And they are not based on what is the main and after, no, because for example, they are totally different. And you should use chemical device such as succinic acid. You should use hydroquinone or polyphenol. You can use laser if you have, and you should use, for sure, you should use home care cosmetic like Institutum. So what the next is it possible to get rid of pigmentation at home? How it is really? Well, you can try.
Oh.
You can try, but if you will come to me, you will ask and tell that you will try to do it at home, and after that you will come back to me in half a year. No problem, it will just cost twice.
Yeah, it's kind of impossible, especially if the patient have dermal pigmentation.
Nothing is possible to do at home. At home, you just the only thing what patient can do at home is to do what the doctor have prescribed, to do very carefully. Everything else is impossible to do at home. And if the patient is thinking that he is very clever and he want to not to spend money, okay, no problem. Don't explain them, just tell them that, guy, see you in half a year. And remember, and put the mark, well, put his surname on the list and put the mark. The consultation and treatment have cost twice. Because he is asshole. He don't believe his doctor. He want to try, and he have to pay for this. Our patients have the right to do everything what they want. They have just to remember, if they are doing everything like we are prescribing, everything is okay and it's much more cheaper. If they are doing like they think, they also have the right. But everything will be not okay and it will cost much more, finally.
Yeah, agree.
And well, pigmentation cannot be treated in the summer. It depends, as for me. What's your opinion?
Oh, it's a myth because Indonesia is summer whole year.
Yes.
Like, yeah, please come to Indonesia and embrace the sunlight like the whole year. Even like when it is rainy, the sun still shines so bright. So pigmentation can be treated in summertime, but it needs some more compliance from the patient, and they need sunscreen. They need to reapply sunscreen like every 3 to 4 hours, and they aside than that they need like something to block the sun, like use a hat or cover their face, but or umbrella. But it is treatable in summer, but with more effort.
Yes, what I have taught, it depends. If you have the possibility to not to treat in summer because you have autumn, spring, and winter, it depends what kind of pigmentation, because if it's melasma, doesn't matter, it's disease. If it's the anti-inflammatory pigmentation after the CO2 laser, you can wait 1-2 months. But it depends. If you are living in Jakarta, in Bangkok, yes,
Yeah.
well, you know that you have winter, but unfortunately, that winter looks like summer. So, and there is
Yes.
no difference. The difference is it's rainy 2 hours a day or it's rainy 8 hours a day. This is the difference between the period of the year.
Yeah.
So only the sun's rays lead to pigmentation. Well, It's totally not true because we understand, yes, 30 years ago it was like this. Now we understand the quantity of pigmentations after different procedures are even much bigger than the pigmentation after the sunscreen, after the sun rays. And even more, if you are afraid of the pigmentations that can occur after sunburn, you can use sunscreen, you cannot be on the open sun, you can stay under the tree or something like that. But if you have in your anamnesis CO2 resurfacing and after that pigmentation, doesn't matter where you have did it, in Jakarta, in my country, in my city Lviv, or in Sweden, doesn't matter, the result will be the same.
Yeah.
And now, Inneke?
Yeah.
And I want to show you some great results of the one great doctor from Indonesia that she achieved with pigmentation. We will not tell that this is Inneke because she is here. And that result were achieved with the treatment with Xeloriderm. So, for those who don't know, Xeloriderm, it's succinic acid with hyaluronic acid combination, and the quantity of succinic acid is stable in every syringe, is the same. The quantity of hyaluronic acid, there are 3 types of the quantity of hyaluronic acid, and it depends what type of patient, what problem, what you need to have as a result. You can contact your local salesperson from Hidajat, and they will show you, explain you, or you can contact your local trainer and they will make you the workshop about how and where to use different products. But you should remember that the level of succinic acid, the major agent in Xeloriderm, is the same in all the products. So here are before, after. If somebody don't see the results, so please, first of all, the first option is to switch from the phone to the laptop, and you will see better. Because I saw the result, I see the great result. If you switch to laptop and don't see, there is the next option. Call to your colleague ophthalmologist. Maybe you need eyeglasses, because the result is really great. The same as here. And here. And, oh, we have some more questions. And one more here. And you see the results step by step, from procedure to procedure, and we see the lightening of the wall skin and the lowering of the pigmentation. Because Inneke is a great doctor. She's not cheap doctor, but she's great doctor. And this is one more. It's Q-switch neodymiac, what we were talking, and mesotherapy with Xeloriderm. As I understand, it was hyperpigmentation elements after the acne, yes? So it's great, really great result. So we have some more questions. Meso-injectable is best for melasma or pigmentation. What's about the result of meso-cocktail injection? Dear Dr. Altaf Khan, we, not me nor Inneke, told that meso is the best. We told that injection of some chemical substances like succinic acid. On the worldwide markets, we have the product called Xeloriderm. It's succinic acid and hyaluronic acid. You should contact your local hyaluronic representative, and they will give you all the info. But I don't believe into those traditional methods that we were doing 20 years ago. I don't believe even more. The majority of the meso products are forbidden for injection. And in the major countries, if you will have some problem, you will have the big problem with this. I mean, if you have some medical problem, after that, you will have the big legal problem. And Xeloriderm, it's registered for the injection. And doesn't matter melasma or pigmentation, you can use xyluriderm because, as I have told, the way of action is different. It acts on suppressing of inflammation. That is why it doesn't matter what kind of pigmentation you have, you can and you should use. And the only difference is the time of achieving the result. Well, Dr. Krypton, I have read that pico laser not recommended for melasma because pulse with pico is too small to thermal relaxation time of substance melanosomes. What is the option, sir? Well, sorry, doctor, I don't know about the idea that pico laser is not recommended for melasma. I understand how pico laser, if you are talking about PicoStar, how it works. I know that it will give the visible result, but what we have explained before with Dr. Inneke, that the result, melasma, it's treatable but uncurable disease. So if you want to have the long-term result, you should use starting from Q-switch to Pico, but anyway, you should use the injectables of succinic acid. Ayesha Riz, role of tranexamic acid, oral and intralesional, role of microneedling and mesotherapies in treating of melasma. Well, mesotherapy, I have told. Microneedling, what for? I don't understand, because with microneedling we can, as sometimes the hyperpigmentation can be. If we are talking about EBD, if we are talking about microneedling means roller, what for? If you are using it as a way how, for example, succinic acid can deliver to the skin, okay, but just microneedling as microneedling. What's regarding tranexamic acid oral, yes, I have heard that really good result, but as we have told with Inneke, one way can't be the only way. So we need to use the combined therapy. Well, one more. What is the period that we have to stop the injection of hyaluronic acid before the laser treatment, and have we remove fillers from that placement? No, there is no connection. So you can inject HA, and in 2-3 days you can make laser treatment, and no difference at all. So don't be afraid. There is no connection between HA and lasers, at least because we are injecting HA into the fat, into deep fat, into superficial fat, sometimes supraperiosteal, but we never inject it into the skin, nor in epidermis, nor in derma. And the deepest laser, the deepest one, can bring energy just to derma and never to the superficial fat pad. So you are dealing in different layers and there is no risks.
Okay.
So,
Great.
Can you please return and comment in detail the clinical results of Dr. Inneke? Dear Sana, what exactly? Yes, we can return. We will now comment in details the clinical practice. We will discuss that Inneke have no result. All this is Photoshop. She was preparing yesterday all the evening. She was doing the Photoshopping of the photos. So what exactly are you interested in? Because I saw the great result. For example, here, okay, let's comment. Here we have a lot of pigmentation on forehead and here, and you see the smoothing of the color. Okay, the lady on the photo, she's from Indonesia. She is dark skin, yes? So she will never she will never have white skin, but she has much smoother color of the skin. For example, compare here and here. Here you have a lot of pigmentation. Here you have the smooth, yes, dark color of the skin, but smooth. Not all of them can be so beautiful as Inneke. She has white skin. She's really beautiful girl. Oh, sorry, beautiful lady.
Thank you.
Nice, young, pretty, sexy. But okay, patients, they are as they are. But you see that patients here have a lot of pigmentations. Small pigmentations, I mean small particles, but there is a lot. And finally, we have the big pigmented area here. And don't you see the result that, and it's not even final result, but it is that the quantity of the quantity of particles are much less, and the color is much less dark. The same is here. There was the big pigmentation here, and it's probably invisible here. Well, I see the difference. There was pigmentation, that there is no.
Yeah.
Other hand, what for? I mean that it's not her. On her face, it's not the biggest. It was not the biggest problem, that pigmentation. But as I understand, she come to you and asked that she need to do something. Yes.
Yeah, it's a post-inflammatory hyperpigmentation from iron curl, like girl doing. Yeah.
And here also, well, look on this
Yeah.
part and compare with this.
Yeah.
Well, what is your option about IV glutathione, intravenous glutathione, and what for? For treatment of pigmentation, I never heard. For anti-aging, okay.
We couldn't hear you earlier.
Inneke, have you heard the question? The question was
No,
from Sarah Habib.
okay.
What's your first line treatment for melasma? It seems to me that we explain. It depends. It depends on it's deep or superficial. It depends what you have, but for sure, what you have to use it Xoloriderm. And it can be the first line because it can be for the preparation. Also, it can be for the anti-inflammatory therapy to reduce the low grade inflammation, and that is why Xoloriderm can be the first line, and you can also combine with those things that you have.
Yeah, agree. Topical treatment and Xoloriderm to prepare the skin for any procedures that you are going to treat your patient with melasma.
So I'm checking, maybe there are some other questions, because if there is no question, we are already 1 hour 10 minutes, and we were discussing with Inneke yesterday that, well, she is young girl, but I'm old guy, so not more than 1 hour 15 minutes, because I will be tired and I will go sleep and else. So, no more questions. Okay, so guys, if you will be interested in more info about Xoloriderm, you can always contact your local Institute representative. If you have any questions to us, we have the last slide, and you can choose Dr. Inneke Instagram, my Instagram. This is the Academy Instagram. You can choose, you can ask any question, and I'm sure that you will receive the answer. And we will be glad to see you next time on our next webinar, in our next Disputable Club. And bye-bye.
Thank you.
Hope
Bye-bye.
you